Hi patient, we are here today to talk about a new medication that doctor has prescribed due to your high blood pressure, also called hypertension. Hypertension is often called a silent killer because you might not be feeling any symptoms, but it can lead to very serious complications. Blood pressure is measured in two numbers, the systolic and diastolic. Your systolic is the amount of pressure in the arteries when the heart beats, and the diastolic is when the heart is at rest or in between beats. Now, not managing high blood pressure or hypertension can lead to coronary artery disease, heart failure, or a stroke, so doctor has recommended taking a medication as well as combining that with diet and exercise, reducing your alcohol consumption, and quitting your smoking habit because these can all be factors that lead to high blood pressure. I'm going to go over the medication the doctor has prescribed, how it works, side effects, and when to take it. All the information is on Micromedics and in Karch's pharmacology book. So the medication the doctor has prescribed is called Atenolol. The brand name is Atenolol. It is an antihypertensive and in the class called beta blockers. So that means it blocks the beta-1 adrenergic receptors. These are receptors in the heart to decrease the workload of the heart and the amount of oxygen the heart uses, as well as it reduces the amount of renin that's secreted by the kidneys. This is an enzyme in the process that increases blood pressure called the RAS, which we can dive into all the fun things of the RAS another time. But in summary, it blocks those mechanisms that increase the blood pressure because we need to bring it down. Now, because we are bringing blood pressure down, you might experience some side effects. Some of those are a slower heart rate, low blood pressure, dizziness, fatigue, headache. It can make it feel like you have cold extremities. It can cause GI upset like nausea, vomiting, or diarrhea. It can also mask the symptoms of hypoglycemia, so that means you might not be able to necessarily tell when your blood sugar is low. It can also cause a decrease in libido or impotence. So if you are experiencing any of these side effects, please give the office a call and we can let doctor know and discuss these things and remedy that as needed. So you are going to take Atenolol once daily at the same time every day. However, prior to taking it, you are going to take your blood pressure and your heart rate, because if your heart rate is less than 60 and the systolic, that first number we talked about, is less than 100, you're going to hold your dose for that day, or meaning not take it. Because as we discussed, this mechanism of action and how the medication works is it brings everything down, and if those numbers are already at 60 or below or 100 or below, we're going to want to not take the medication that day. So you're going to need to get one of the blood pressure cuffs to have at home and check those numbers before taking that medication. Now, as I mentioned, the medication is taken once daily, ideally at the same time every day, and without regards to food. So you can determine if you want to take it with a meal or not, like at breakfast time per se, or whatever time works best for you. If you are having any issues or have any questions about the medication, please don't hesitate to give the office a call, and we can assist you with anything that you might need.